Okay, everybody, welcome to our session in Florida Climate Week's group of presentations. I'm Catherine Toms, and I'm here with my friend and colleague, Claudia Moreau. We'd like to welcome you to our session, and a special thanks to the Volo Foundation for convening us all here today. And a very special thank you to Nicole Salzberg for her countless hours and her patience in making all of this come together. So, and then I'd just like to mention our dear friends and colleagues on the West Coast of Florida, especially in the Tampa Bay area. We have you in our thoughts, and we hope you stay safe and dry, and just know we will be there for you when this is over, and together we'll pull through this. So with that said, I am going to allow Claudia to kind of tell you why she's here today, what brought her to this point, and then we'll take it from there. So welcome, Claudia.
Thank you. Thank you, Catherine. I appreciate this. We appreciate the opportunity to be here and to be able to speak about the collaboration that we have with Green Cars for Kids and how all that ties into climate. I have been with the company for almost 3 years right now, and very passionate about transportation, about connecting communities, and definitely about sustainable and green initiatives that we are now bringing to different parts of the state of Florida, really raising awareness and getting people excited, right, about what these green initiatives mean for our climate, for our environment, and how everyone can basically add their little grain of sand and really just help make the world a greener, a cleaner place.
Great, thanks. And I'm Catherine Toms. I lead Green Cars for Kids. We're going to talk about that a little bit more today. And I'm sharing my screen now. I hope you guys can see it. So I just want to really point out that we're here to talk about how to better educate, engage, and act when it comes to addressing the climate crisis. And I think it's always important to keep your eyes on the prize. So what is the goal of everything we're doing here? All the time and energy and all our resources that we're putting into this. And it's to prevent the catastrophic destabilization of our climate so we can go on living and thriving, and our children and our children's children. And to do this, we have to spur action. I feel as though our colleagues, and we have been doing this too, we've gotten pretty good at educating, at getting the word out, communicating about the hazards, the health hazards, all the benefits to our community. But we really need to push to action, because if we don't, we're going to fall short of our goals of meeting the IPCC's goal of staying below that 2-degree mark. And the best way to do that, we know, is to transition away from our fossil fuel economy. That's a big ask, but we can do it because we've done it in the past. And we're going to just, in the first few moments, kind of inspire you to see it's a challenge, but it's doable. And what do we want to accomplish in doing this? So let me just go on to the next slide. So when you break down our greenhouse gas emissions, that's what we've got to bring down to be able to avoid further more violent storms like Tampa is just looking at coming toward them, and all the heat that we're exposed to that leads to premature death and across the globe. So those are just two examples. But what we need to do is lower our greenhouse gas emissions. And if you take a look at this, so when I was first looking at how to do this, I realized something really jumped out at me. And it's that the biggest contributor to greenhouse gas emissions is transportation, right? If you look there on the
Right.
left part of the screen, it's almost a third for the US. That was in 2022 that they calculated that. That's more than any other sector. Then again, when you look at Florida and here in the upper right-hand corner, it's almost 40%. That isn't exactly our greenhouse gas emissions, but that's our energy consumption. And the vast majority of our energy consumption is fossil fuel based. The actual number is, let's see, 42%, I think, from one of the measurements. And if you think about that, the vast majority of the passenger miles traveled with vehicles is from private vehicles. Our cars, 81%. Trucks are important, but really 81% of our pollution from transportation is from us. Um,
And when you think about that, Catherine, I think that when you're talking about the biggest contributor being transportation, it's also the biggest opportunity for us to make that change and transition, the way that we move within communities and the way that we do all these things. I think somebody needs to mute themselves. Um,
Yes, we can mute you, but it's easier if you go ahead and check and mute yourself if you've got your volume on, because I'd like to allow everybody to engage in the conversation as we go a little further. We want to hear what you think. So
thank
Claudia, you're so right. It is, and this is where freebie comes in. It's where Green Cars for Kids come in. We're going to delve into that. Um, is the opportunity. And it's an opportunity, and as you'll see, not just to address the climate crisis, it's an opportunity to make things better in almost every aspect of our lives. And I really want to put an emphasis on better. And that's why I'm not sad about these numbers like I used to be, because I see it as a very powerful tool to come together and leave behind a much healthier, vibrant society. So and here you go. And we're both in South Florida, Claudia and I. She's in Miami-Dade County. I'm in Delray Beach and Palm Beach County. And so if you take a look at, this is from the Southeast Regional Climate Change Compacts inventory that they did, 53% of the four-state Southeast Florida or four-county area is attributed to transportation. So this finding out where the problem is where you see the opportunity, in my opinion. What do you think, Claudia?
Absolutely. Transportation is definitely the biggest opportunity, something that we can do, that we can act on ourselves and in deciding what kind of vehicles that we purchase, the kind of vehicles that we use. And one of the things that I love about Freebie is that the entire fleet, that all the vehicles that we use in our fleet are 100% electric. And what does that mean? That means that, we're taking cars off the road. So that helps right there with the climate, because there's fewer cars that are, putting fossil fuels out there and their carbon emissions and all that. So that's great as well. That helps reduce traffic. I mean, I think it's a win-win across the board. But also, one of the things that I see, right, Freebie contracts with different cities, with different counties. We contract with universities, hotels. And what I'm seeing is that a lot of these public sector, right, the cities, the counties, they're all moving towards electrifying their fleets. Everybody is more conscious, like you said. For those of you who just joined us, one of the things that we were talking about was the 3 points here: educate, engage, and act. And what Dr. Thoms had been saying was, we've done a great job of educating, right? And we're now in the engagement part and act. And I think that a lot of these cities have taken that education on the counties and said, you know what, we need to do something about it, because we have this huge fleets that we have out there, whether it's a bus system or what, a trolley, and they're going out there, and slowly but surely they're starting to replace their fuel fleets with electric vehicles. And we're seeing that, and Freebie is also a part of that, by adding microtransit to the first mile, last mile component. And even to take it a step further, some of the cities, right? Because then the challenge becomes, oh, well, maybe we don't have a budget to electrify our entire fleet. But here's what we can do. We can bring in microtransit. And so some of the smaller cities that have smaller budgets, Freebie's a great option for them, because then they can, it doesn't always make sense to maybe bring in a bus line or bus route, but it makes sense to bring in microtransit. And it's a way to help folks, ride our vehicles. And a lot of, of any of the misconceptions that folks have about electric vehicles, when they get into our vehicles, they get into our Teslas, or they get into the GEM, the golf cart type vehicles, and they get in, they're like, wow, this is very cool. I like it. The ride is amazing. And it kind of changes their perception. And I think that's part of what we need to do. Part of the task here at hand is change that perception so that we can slowly but surely make those transportation numbers that we saw on that pie chart kind of start to shrink a little bit, right? And I think that that's a big part of what we can do with the communities is giving the folks that experience so that they can open their mind and say, you know what, I think this year I'll start with a hybrid vehicle, and then I'll move into an electric vehicle when I realize that the majority of my travel is being used with electric and my fuel is still intact, right? I think that's a lot of the experiences that folks who get hybrid vehicles, they tell us, they're like, oh, wow, we did a hybrid vehicle and we realize that we're not really getting fuel, stopping for gas or whatnot. So most of what we're doing is actually being met through the electric side, right? So we're excited about that, and there's so many more things that we can talk about moving
Yeah.
forward. So I'll kick it back to you.
Yeah. So back to, I love this about changing the way we look at transportation, not only public transportation, but these new forms of microtransit, and also freeing yourself from having a car always harnessed to you, and not only the insurance costs and the repair costs, but just it's a way to sort of have your own personal chauffeur. You can do other things rather than worry about, watching traffic as you're driving or being late. It's somebody else's problem. But back to personal vehicles, because ever since Eisenhower started the interstate system, we are a nation that's built on cars, and that can change, but that will take a lot longer. So in my opinion, and there's a lot of data to show that, the way to do that is to quickly transition to electric vehicles, passenger vehicles. So now things have really, really ratcheted up. So now you can afford an EV, a brand new Nissan Leaf, you can buy for as little as $30,000. You can come under, and that is high for a lot of people. And I know that there's a big swath of people that can't afford that. And we're going to be addressing that as we go. But this is kind of speaking to the masses, and what we can do as individuals. And there's so many cool options, like the groovy Ford Mach-E is it, New York City, their police department has the Mach-E as a fleet vehicle. So it's very doable. And then the VW Buzz, it's coming on the market. Everybody's waiting for it. Everybody wants one. When I talk to anybody about it, Claudia, right?
We've been waiting for it for a while. It was late last year, and then it was early this year, and now it's late this year. So we'll see when it comes out. But we're excited to see that the Buzz. I think it's the ID4 Buzz is what it's called.
Yeah.
But really excited about that. And again, I think that the more the time passes, we're gonna have so many more options to choose from when you're talking about you're on the market for an electric vehicle. And and you're right about the price point, but I think also fuel is a big price point for a lot of people. When you look at it, if you we're located in Miami-Dade County, and a lot of folks travel very, very far just to get to work every day and back. And that becomes a huge part of the fuel. So I think it's part of also the consideration when folks are looking into an electric vehicle. Does it even out at the end of the day with the expenses that they're saving on gas? And, they're making those decisions. I also wanted to say that one of the things that we have found with offering electric microtransit is that and this is great for the environment, is that a lot of these 2-car families are now becoming 1-car families, or just doing away with their car, because now cities and counties are providing these microtransit solutions that say, hey, you know what, maybe one of us works from home, doesn't need a car except for running errands, and then they could use microtransit services like Freebie to go to the store, to go grab something to eat. And so we see a lot of folks doing that, and when you couple that with the increase in housing cost, right, it just makes sense. They say, where do I have an extra $1,000 sitting around? They look outside and they look at their gas guzzler, right, their car, the expenses on the car, the fuel, the tolls, parking, it all adds up. So I think that we're doing really great stuff by making these families go one car families. That's less carbon emissions on the road. Again, it is little things that they end up adding up and having a huge impact in helping us reduce those numbers.
And for those of you sitting on the fence still, and to piggyback on what Claudia said, so the data is out. And in fact, today, you can save about, the average family can save about $700 in fuel costs by switching to an electric vehicle. It's much cheaper to charge than it is to buy gas now. And
That's a car payment. That's a car
yeah,
payment. That's a nice car payment.
yeah, and the insurance costs. We've in fact considered going down to one car because insurance, as we know in Florida, is so expensive. And then top that off with the generous tax incentives from the federal government, up to $7,500 for new models, and now used vehicles. If it's much cheaper to buy a used vehicle, so it makes it more affordable, you can get a tax incentive, and a rebate essentially of up to $4,000 for used vehicles. But we are just not making this transition fast enough. And if we're going to meet our goals of reducing of 100, so the federal government has a goal of 100% new zero emission vehicles by 2035. That's not much time. That's 11 years. So we are right now, as of May 2024, less than 7% of new cars sold were EVs. So they're better cars for many reasons. They have much better acceleration, much less noise. If you have a teenager or a young daughter, they don't have to stop at the gas station, at night when they're coming home. They just plug in when they get home, or they can plug in a charging station that's conveniently located in their neighborhood. And there are going to be more now with all of the great things that the IRA and other federal funding streams are enabling. So, but really, why on earth are we so slow to adopt this? And we do have a lot of information out there, a lot of people talking like us. And I really thought about this. And this comes to the reason why I started Green Cars for Kids. And it made me think, what sort of other products have really had a very rapid rate of adoption, and how did they do it? So it made me think about smartphones. And if you guys think back, and I know some of you are maybe too young to remember life without a smartphone, and I hope you're on this call, but for those of you who do remember, the first iPhone came on the market in June 2007. That's not that long ago. And then this Pew Research study shows that 90% of us, US adults, own a smartphone. That's a short 16 years. And I find that phenomenal. And it wasn't because, yes, Apple did a lot of information, but really think back. Why was it that you decided to give up your landline or your flip phone to get a smartphone? It's much more expensive. It actually doesn't make financial sense. But I think
Mhm.
the reason was simply it was a better product. And your friend who was an early adopter, who you sat next to at a concert, and you were thinking about that email you didn't really answer, they were sitting on their phones answering an email and feeling very comfortable about that and feeling good. They had access to the whole world in this little square thing. That is exactly the way we need to look at transportation electrification. It is a better product. And so what we need to do is get more exposure. Yes, we can tell people like these presentations that we're doing, but really, let's get people in electric vehicles, was my thought, and let's show them what it's like, get them familiar with it. So that's where freebie comes in. Because people get into electric vehicles. They have electric cars, not just the cute gym car that you see behind Claudia, but also vans, and they have Teslas and other electric vehicles. So I'll let Claudia, I know you have something to add to that, so I'll let you hop in.
Well, I had already mentioned that. I think that, having that experience for yourself, a lot of it is the fear of the unknown, right? Folks don't know. They go, they have misconceptions, or if they hear this or they hear that. But once they have the experience, it really does change. And I think that's the biggest thing too for freebie. It's not really just about getting somebody from point A to point B. It's also about what their experience is like. And of course, as we know, everyone, no matter what age you are, I mean, the app is such a huge thing. Folks do everything through an app. They order food through an app. They order groceries through an app. They buy their movie tickets through an app. Everything is done through an app these days. And so the fact that, we are able to mimic what the community likes, how folks are actually doing things. And so I mentioned rideshare, right? There's rideshare out there. Everyone knows that years ago, when rideshare companies like Uber and Lyft broke into the market overnight, basically, people really liked the fact that I can request a ride on demand when I need it, how I need it. So, gone are the days really of going and waiting for hours at a bus stop, at a trolley stop, and basically having to fit your schedule around the schedule of whenever those stops come and go. Having this public transportation version of rideshare, which is what freebie is, you have the ability to request a ride by hitting a button right on the app and being able to get it when you want. So it's on demand and it's a door-to-door service. And that is, I think, the part of rideshare that really was attractive to a lot of people is, hey, you're going to pick me up. You're going to meet me where I am, whether that's my home, whether that's at a restaurant, whether that's a place of business that you're patronizing, or maybe your place of work, or is it a doctor's office? So really having that ability to go door to door and, in most cases for either no cost or low cost has been something that's been really attractive to folks. And you get to do it in this electric vehicle, and you could feel good about this ride because now, you are doing your part in creating a sustainable environment for your community. You're taking cars off the road. You're freeing up some of that limited parking availability that we find in a lot of commercial zones and main streets and downtown corridors, that just there's not a whole lot of parking. And you can feel good about it because you're saving money, you're saving on gas, you're saving on fuel, and you're having this experience and saying, hey, you know what? These electric vehicles are pretty cool. You know what? I'm going to look into this, or this is going to be my main way of moving around and connecting. I think that folks really learn with microtransit. It's not exactly like rideshare in that a lot of the times, microtransit, they have just a limited number of cars available, 5, 6 cars, 3 cars in some areas, depending. And of course, when you talk about rideshare, there's thousands of people that are using rideshare. So your ride is going to get there in 2 or 3 minutes. But I have found that folks learn to manage their expectations. They learn to plan their rides. And our avid freebie riders are like, okay, well, if I'm going to request a ride, I know it's an average wait time of 10, 15 minutes, 20 minutes, but I can do that and, request my ride, shoot off 2 or 3 or 4 emails. And before I know it, my ride is there. Or if I'm, at home with a bunch of kids, I can throw in a couple of loads of laundry, and then my car is there, and I can feel good about all the different things that I'm doing because I'm still able to move around. I'm saving money here for my family because maybe I'm a 1-car family. I'm not putting carbon emissions into the environment. I'm not taking up parking space. I'm not causing traffic. And so all of these things, again, have this huge effect on your community, and it makes it a higher quality of life. I really do believe that it makes for a higher quality of life. And I'm extremely passionate about connecting communities to making sure that everyone can get to work with microtransit. It can get to a doctor's appointment, can get to a pharmacy. Our seniors, huge riders of microtransit. I know we talk about the pandemic and how it affected seniors, that they were feeling so, lonely, they couldn't go out, or just because they don't drive anymore, right? They have to depend on some maybe an adult daughter or son to take them to do simple things like going to the grocery store, going to the pharmacy on a Saturday or Sunday when they're off. And really, when you bring in a service like freebie, you can give them that freedom of they can go and move around whenever they want, not just to do their groceries or go to the pharmacy, but they can have a social life and go have lunch with a friend or participate, in a yoga program at a park and just sit around or what have you. It just opens up so many more opportunities. And I really want to talk about the opportunities, Catherine, that this has done. This has really provided for the children that need access to healthcare and the parents that are taking them to the healthcare. That has been such a big thing, in our community, providing that
I'm
access.
I'm so excited to share that with you because it has it's a trifecta solution, and I'll tell you more about trifecta solutions, but it has more to it than just transportation. But I just want to use a little example here where I left off about the smartphone. Some of you
Mhm.
might have said, okay, well, that's a smartphone. That's a whole lot easier than an electric vehicle. But I just want to give you an example of Norway. So in 2017, Norway's percentage of new cars that were electric or hybrid electric vehicles in 2017 was about 20%. And compared to where we are right now at less than 7%, you're thinking, wow, that's humongous. That's great. Well, they didn't think that was so great because they had set a goal of being 100% electric or another form of zero emissions vehicles by 2025, right? That's next year. So they kind of panicked in 2017 and they put into effect a lot of incentives. And then they supercharged their, pardon the pun, their investment in fast charging infrastructure because they understood this range anxiety amongst their people. It's a huge cold country and they have to cross a lot of distances. People had some range anxiety. There are a lot of rural areas of Norway. So they really made sure there were fast chargers, not just, level two, in that were accessible to everybody. A lot of people live in apartments in Norway, so they really wanted to address that. So after all of that and all these various incentives and things they did in communities to make it easier to even more easier to get around on public transportation, everything, in just 6 years, in 2023, last year, they measured their share of new vehicle EV sales. It was over 82%. That's just 6 years. And okay, you can say Norway's a small country and it's different, but that is a great example. So we can meet our goals. We can do this, but we really have to take some personal conviction that's you say my next vehicle will be an EV, or I'm going to at least test drive one and find out what it's about, or ride with a friend, ask someone you see if they like their car. But as we move on, I want this really bothered me. Like many of you, I was facing climate anxiety and depressed. I was really working in the climate and health space as a consultant with Healthcare Without Harm, helping hospitals reduce their energy burden, their greenhouse gas emissions, working with their communities to build resilience. That was all good, but I still felt this sense of urgency. So then, by talking to people in the maternal and child health sphere, and like Claudia and Claudia's great colleagues at Freebie, talking with them, we came up with this concept that's called Green Cars for Kids. And it's no longer a concept that we started in 2021, the end of 2021. It has now been operating for 16 months. We're starting our 17th month here. And so basically, what is it? So what we do is we provide, it's very simple, free non-emergency transportation to healthcare services for under-resourced, low-income children and pregnant women using only electric vehicles. So we're not only addressing the maternal and child health challenge, which many communities across America, not just in Florida or South Florida, are facing, with poor birth outcomes, high rates of preterm birth, low birth weight, and complications with mothers, maternal mortality, even sad cases. I looked at that and I talked with a lot of maternal and child health experts here over and over again through committees arranged by the March of Dimes and other convenings. And again and again, lack of transportation, easily accessible transportation, door to door, reliable transportation. So that's how this idea really is addressing those women that are very likely to end up in the emergency room delivering early, but also this nagging thought for me that we must speed up transportation electrification if we're going to mitigate these huge storms, this massive heat burden that we have on our public health. So, what do I want to tell you more about that? So the goals of our program are really to improve maternal and pediatric health by just increasing this access to care. And by focusing on pregnant women and children, we not only affect their health now and the financial health of their families, because healthcare is the number one reason why people have to file for bankruptcy in America. We are affecting health for generations because if a child is born to term healthy without complications, without vision problems, heart issues, they are going to thrive more. They'll do better in school, studies show. And so we are helping build a stronger economic middle class, bringing those people up who are really working hard to deal with day-to-day financial burdens. By helping them be healthy, we are addressing financial health as well. So, Claudia, do you want to add anything at this point? How the
I
free
do.
then?
I do. I want to say that the other side of that is, when you're a child and you're being transported to your well visits, your checkups, and you're using electric vehicles, I think that, one of the parts, again, going back to the education, engaging and acting, engaging these children at an early age, they're having this, it's promoting awareness for them about sustainable transportation, and again, helping them be conscious because not every family is the same. They don't talk about the same things. So when you are able to kind of expose them to the importance of reducing carbon emissions early on, I think that that has a positive long-term effect. These children who are experiencing eco-friendly transportation options like freebie to go to the doctor, it's more likely that they're going to adopt green habits as they grow. And that's going to, what we're doing, and we may not, this is kind of like a byproduct, but we're helping shape future generations, right? And that will be committed to sustainability. And that's exactly what we need. Again, if we're going to be decreasing those numbers, that's what we're doing. We're basically not directly, but we're calling them to climate action, which is, I think, the biggest part of what we were talking about at the very beginning is how do we bring forth this action. And I think that that's huge when we are being able to influence the young children, and again, and also the mothers who may not have had access. You look at the demographic, and I think you may have a chart on the demographic of the folks that we're helping here bring to the doctor's appointments. Of course, we've always said that an ounce of prevention is better than a pound of cure. So this is exactly what we're doing, is we're getting ahead of any potential problems that can come down the line as far as health risks with providing this care early on. Anything you catch early on is preventative, is much better. So again, maybe this demographic would not have access to ever ride in an electric vehicle, but because they're doing it this way, I think it helps also form a positive connection, because being able to get to your healthcare appointments is a positive thing. It's a stress reliever. You don't have to worry about, I think, like what you mentioned, having a door-to-door option. A lot of folks have to walk 2 and 3 blocks to get to a bus stop. Now imagine doing that here in Florida. You're going to add the heat. You're going to add those torrential rain showers that we get for 10 minutes, and then it goes back to being a sunny day. But then add to the mix you're a mother, you're tired, and you have a couple of children, maybe one whose hand you're trying to hold from running into the street and the other one in a stroller. And so it just becomes overwhelming. So this is a positive thing. It's a stress reducer, and it's, they feel so happy and grateful that they're able to do something that for the rest of us who have, mobility, it's easy, right? You don't even think of it. It's an afterthought. But for these families, it's a huge impact. It makes a difference. And when we're talking about Florida and the large areas that you need to move around in, things are not close together, right? In every single circumstance. Sometimes the hospitals are outside of your immediate city. If you have, something more serious that requires a hospital visit, or even some of these procedures are in hospital facilities. They're not something that your regular doctors are doing in their offices. So again, I think it's a huge impact that we're having, and a huge way to engage and see positive results in the future, from a sustainability standpoint, and adopting those green habits early on.
Yeah. And you brought up a lot of really good points. I loved your story, that visual of a mom waiting at a bus stop and then all of a sudden there's a downpour like we've been experiencing. If she knows that's coming or could come, she may just say, you know what, I'm going to miss that appointment because she has to make a decision. And that's where the lack of good quality regular prenatal care leads to birth outcomes. Her hypertension isn't being controlled. Her diabetes maybe isn't being controlled. Maybe she's had a preterm birth before. All of these things that can prevent these costly things to hospitals. Hospitals are really having trouble budgeting and meeting the bottom line. And if they can, make sure these women are getting the care they need to be healthier, it's also helping finances at healthcare institutions. So to the best of my knowledge, Green Cars for Kids is innovative because you can say there are quite a few non-emergency healthcare options out there. Lots of insurance companies, health insurance companies have their own. But to the best of my knowledge, we are the only one in the US that only uses electric vehicles. And that's important because a lot of these women and all of us are exposed to air pollution that's from fossil fuel burning, mainly from cars. And when you're living on a busy street, which I live a half a mile from 95, if you can hear the traffic on that highway, you're most probably getting the air pollution too. So the American Lung Association, the American Heart Association have been amazing institutions in really addressing how fossil fuel pollution makes people sicker, both lung health, cardiovascular health, everything. So,
I wanted to add one more thing just to piggyback off what you said, because you reminded me of something when you were talking about living close to 95 and the noise. And we were talking about the children, right, that use this. We have to talk about that some of the children that we're helping get to these, appointments that have a need, some of them have, autism. And you're talking about sensory overload. And you mentioned earlier that, the electric vehicles are quieter. So if there's one component that you can help folks with, the kids with, and bring travel in a quieter car to kind of help offset that sensory overload that sometimes they suffer from. I think that's also one more positive thing that an electric vehicle does over a regular vehicle, or one of those vans, the transit vans that are used to take to these different appointments and such. So
absolutely. You have such good points, Claudia. I love it. So here's the meat and potatoes of the program. So we provide 50 hours of door-to-door service with our cars. And that includes the car, the driver, a scheduling software that was designed just for Green Cars for Kids that the clinics can use. Um, we partner with a clinic in Broward County with Broward Health, and then with Jackson Memorial Hospital now in Miami-Dade County. We are looking to bring this service, once we get all the funding secured, to Palm Beach County, serving the Glades community, because that's basically a community that has a maternity care desert, and being able to get kids who need specialty care to clinics in Wellington and West Palm Beach from there. There's no specialty care for kids with asthma, diabetes, any other kind of care. It's only general practitioners, pediatricians there, and then mothers who need to go to the Rippick Center in West Palm Beach for high-risk maternity care. So the Quantum Foundation has been very good in supporting us with that. We're looking for someone else who really sees the value of that. Those of you who know funders, have friends, please put the word out, because we are growing, but we need to grow faster, and we can really use your help. Okay, let me go back to, I diverged a little bit to what we offer. So the portal, the scheduling app for clinics to use, we provide through this wraparound service that Freebie provides, charging costs, the driver's salaries, and we provide language appropriate brochures in Spanish, Haitian Creole, and English that explain the program to our clients, and that includes liability insurance, which is a big bear in the state of Florida. So, and one thing I wanted to say, we're using Teslas now, but just a little insider information, we're now talking to a major automobile manufacturer that's really investing in electric vehicles, but has a plant that's only invested in electric vehicles. We're talking to them about providing in-kind leases to us, so that lowers our operating costs. And stay tuned, watch it, follow us on social media, and we'll post when that partnership is final. We're excited that that's coming, so that those are more every man's kind of car. So low and middle income people can really see, this really fits my lifestyle. This is something I can save for, something that I can tell my friends about. Another thing I wanted to say about the drivers, they are not just your average gig workers, they are invested in the program. I cannot tell you how amazing our drivers are. They care about our riders. In fact, one of our drivers called me all excited that one of the moms, she'd been driving for months, gave birth to a healthy baby, a little baby girl. And then she started to cry, and she told me the name of the girl. And her name was Joanna, named after the driver. So that, for me, that just tells you the bond that we build and the connections that we make. Another thing is the drivers are trained by Safe Kids Worldwide. That's the training mechanism that trains the fire departments and the police department employees on how to install car seats safely. So our drivers had that same training. It's rigorous. I did it. And so when they have time, they're finding this downtime to show the parents how to install car seats safely, so that if there is an accident anytime in that child's growing up period, when they're using a car seat, even when they aren't using Green Cars for Kids, those kids are safe. And we can really prevent accidents from hurting and killing children through our program, through our amazing drivers. Another thing that we have is we have a branding opportunity with Freebie. So if you look on the side there, you'll see the March of Dimes. They fully funded our pilot program, our initial seed funding. They've been great partners. And then you'll see on the next slide, well, let me just go ahead and show, oh, it was in the back, this slide here. Then you see our other funders are here, the Women's Hospital at Jackson Memorial, and the wonderful, wonderful Health Foundation that is really investing in this, because they see the connection between climate and transportation and good prenatal care.
I also wanted to mention, since you were talking about safety and the drivers, yes, I agree with you. Our drivers are 100% amazing. They are truly the face of Freebie. But I think that also, safety is a huge thing. And so for moms, you're taking your children, those are your most prized possessions, right? to a doctor's appointment, you want to make sure you're getting into a safe ride. So all of our freebie drivers are 100%, freebie employees. They are W-2 employees. If they work with us full time, they get health benefits. So all that to say, they are not independent contractors. And because we are considered public transportation, I see some folks on here from different cities, we have to conform to FDOT, which is Florida Department of Transportation code 14-90. Now, what does that mean for you? That means that we are doing level 2 background checks on all of our drivers. That's a deep dive into each driver. We do health screenings. We do drug testing. We do random drug testing. We even do sleep apnea studies so that when you get into one of our vehicles, you know that you're getting into a safe ride with freebie. And then on top of that, there's cameras in the car. We're capturing visual. We're capturing audio. We have cameras facing forward. We have cameras facing backwards. If heaven forbid somebody should rear end us, we have a whole, a complete view of everything that's happening in the cars at all times. And I think that really adds to the safety component. In fact, I will tell you that 70% of our riders across all of our service areas are women because they feel so safe, and it's always the same driver. So Joanna was named, the baby was named Joanna because she was always the same one taking her to the appointment. So it helps build that bond where the driver learns your name, you learn the driver's name, and you almost feel like you have your own private chauffeur, like you mentioned earlier. And that bond is built, right? That sense of community is built. And I think that's one of the wonderful things about this program that
Yeah.
I enjoy. Mhm.
Yeah, you reminded me, Claudia, you're great, about the cameras. So something unique we have in Green Cars for Kids cars is we have iPads, and Freebie's been wonderful helping us build this program. They've just said yes to everything that we've wanted. So we have, much like the taxis in New York, but better, they're safely mounted iPads that the parents can use to choose. First of all, we have March of Dimes health information videos, prenatal care and infant care, things like safe sleep or how to manage blood pressure, like that. And we're developing those in all 3 languages that our writers use. But here's what I want to do, and I've talked with Jane Gilbert, who is the chief heat officer in Miami-Dade County. I've talked with the Clio Institute a lot. There are a lot of amazing other organizations out there addressing climate and health that really want to get information to exactly our client population. Sam Chesser, who leads self-help, he's going to be presenting with Joanne Perodin, who is also an advisor for Green Cars for Kids. She's brilliant. She really understands environmental justice and all the different things. So this self-help organization, they can provide low interest loans and all kinds of financial support tools for exactly lower and middle income people to be more savvy, but also to provide energy efficient upgrades to their homes, things like that reduce energy burden. So that is one thing. We can connect with our iPad other social services and tools, housing support, food, addressing food insecurity, all these other organizations that I know are doing good work. We can connect exactly our patient population to each other through the iPad. And then the last thing that I wanted to mention is there are a lot of other non-emergency healthcare services out there, but a lot of them have limitations. Like if you don't ask for a ride within 48 hours, you can't get one. You can get a ride with Freebie if there's room. We're very much in demand, with much more demand than what we're able to provide with the funding that we have now. But if there's room, we can schedule your ride that same day, just a couple of hours beforehand if it's doable. And the schedules at the clinics are amazing the way they can do that. They're doing ride share in the vehicles. So the women in Broward County, especially at Corey E. Brandon, they are ride sharing. And so the women that are going to early prenatal care or prenatal care, group prenatal care, are going together. So they have time to bond and form relationships before and after their clinic session. And these are lifelong bonds that they can help each other through the child rearing. And that is so valuable. Anybody who's been a parent knows that. Another thing that we can do, there's no limit as long as we have room on who you take. So a lot of these non-emergency transportation services, there's a limit. And so fathers feel left out when they can't go with their partners to these clinics and with their children to any kind of pediatric appointment. So there's that. And yeah, I'll leave it at that. I'll let Claudia jump in and oops, let's see. And then we can go on to some of our results.
Yeah, so thank you for sharing that. I have a personal story, right? I do, but what I was going to say, one of the things that makes me so passionate about transportation is I had limited transportation as I was growing up. And I remember being a teenager and having a job and actually walking 2 miles, to get to work in the rain and the sun and all that. But also currently you mentioned those, some of these transportation services that are out there that are private or public, I would say public. Um, that scheduling of the rides. I have a niece, and my niece is legally blind, so she will never drive a vehicle, and she depends heavily on this. And so I hear it firsthand from her. They give you a window. They give you a window, maybe a 3 hour window, and they could pick you up anytime between that. And I can't tell you how many times she's been dropped off at work at 6:30 in the morning when it's winter and it's dark because of daylight savings times, and she can't see, and so she feels unsafe. Or she likes to cook, and then all of a sudden she forgets an ingredient, maybe a spice or something at the supermarket, and has to wait 48 hours to be able to go back to the supermarket to get whatever she was missing. So I really love that, the freebies on demand. It's when you need it, how you need it, and that we're being able to meet these needs of very real people who have real things like forgetting a grocery item at the store and having to run back and do something like that. So I'm very excited about what we're doing. I love the education component of the iPads. I think that a big part of what we're doing here is education and is also more access, because there's other programs that you're putting on that iPad. You talked about food insecurities. Sometimes there are some food banks available that they're not aware of, and we're meeting so many more needs beyond transportation. And I'm excited about that. I'm excited to continue the partnership. I know that the word is getting out and folks are reaching out to Freebie about this, and we're excited to continue to start partnerships and collaborations that are going to help provide healthcare access and so much more. All the while, we're doing the wonderful job of being climate conscious and moving towards greener initiatives. And so, really happy. I know you were mentioning about the limitation about the funding, and I think we have a question there that I think you want to address. One of the questions that came up in the chat.
Yeah. So first, I just want to tell you how successful our one-car pilot program was after 15 months. And we provided 3,417 trips to healthcare visits or back home to these vulnerable patients that are not getting the prenatal care, the pediatric care that they need to stay healthy. So we're very competitive. Right now, our program breaks down to about $28.63 per one-way ride, and that's super competitive with other non-emergency transportation services that don't offer the benefits that we
Correct.
do, fossil fuel-based ones that don't have these special perks. And 60% of our riders in the Broward County program, the Miami-Dade County program, I can update you on a little bit later once we have more data. But it's about 90% are Black. So we're really getting that population that is suffering from inequitable health outcomes. And about 8.5% are Hispanic, and there are a few Asians in our program, have been in our program. Most of our Black population speaks Haitian Creole, and we've really tried to address their needs. We're going to be working on that some more. And so we are really meeting the population that we aim to meet This is just a graph showing you this is from the Community Health Needs Assessment from Nicholas Children's Health System a few years back, showing that 11.5% of children in Miami-Dade County, that works out to over 73,000 children. In Broward, it works out to over 40,000 children don't get to healthcare appointments they need just because of transportation difficulties. Back to that question. Caroline submitted a really great question on the app, and she said, how are we getting, she said, are we getting the funding needed to really scale this program? We are getting great funding. I mentioned some of our funders, but to scale it, we need partners. We need community partners, but we really need county and city, even state partners, both in healthcare and in transportation, to go after grants, to work together on funding that's already there to address this transportation gap that will lead to really positive birth outcomes. We're running out of time, so I just want to tell you what a trifecta solution is. A trifecta solution, and there are many of them. We can talk about food and different things, but with transportation, it's good for the climate and your community by reducing greenhouse gas emissions and air pollution locally. Lots of studies that show just a few EVs in a community improve healthcare or air quality quite a lot. So also cheaper, good for your wallet. We covered that a little bit, and good for your health. We really covered that. Let's see, Claudia, do you have anything to add in our final words?
I think the final words is exactly what you just went to, is the call to action. I think that the more that we connect folks to the communities and different places through microtransit, it does encourage folks to walk around their community. And the more they walk, the more that we get these cars off the road. So I think it's just, go out and ask your cities to bring in programs like Freebie to help you move around, help you go become a one-car family or completely carless. Go for a ride. Download the app and ride around and see for yourself firsthand what a great opportunity this is.
Yes. Thank you, Claudia. You are a great partner, and I just want to thank everyone for tuning in now and later. The recording will be online. Please share it with your friends and other people who are doing the same sort of stuff we are. And I hope it inspires you to take your passion and incorporate climate active strategies into whatever you do. Thanks.
Thank you. Thank you so much. Thank you,
Bye,
Catherine.
guys.
Appreciate that. Bye-bye.
Bye.